Hey, I'm Dr. Nicholas Lorenz, and we're at Health First Wellness Center in Schaumburg, and we're with one of our best patients. This is Patricia, and we're gonna just kind of talk about your knee pain and what you've been doing here. And even though your knee pain is so individual to you, you know where you feel it, why it happened, how it's gotten better. Your story can, I think, help anyone with knee pain and actually other issues too. So if you could just take it away, tell us what you were feeling, what you've done with it, and how you felt since you started here.
It used to buckle a lot, so my right knee used to buckle. I'd be in a lot of pain. I couldn't bend it. I couldn't move it. And so I went in and I've had a couple different surgeries on it. I had arthroscopic, and then I had a complete knee reconstruction. So it wasn't a replacement, it was a reconstruction where they cut the bones, aligned them so that the knee would be more in alignment and not be rubbing and not wear out all the cartilage. Unfortunately, it did wear out.
Yeah.
Almost all the cartilage.
Yeah.
And so I found out that there was stem cell therapy that could be done on the knees here. So I came here, and
how'd that go?
It was great.
Awesome.
Felt a difference right away, and then they said you have to do all of these different things.
Yeah.
So I was doing therapy and massages.
Physical therapy
right here. And massages, and I'd never done before anything but physical therapy.
Yeah.
I had never had a massage on my knee, ever.
Wow.
And after the first week here, between the shots, the physical therapy, and the massage, I felt very different.
Yeah, because we have some awesome PTs, we got some great massage therapists. And so you were doing this before you saw me, right?
Correct.
And then what made you try Naprapathy?
Well, Princess, who works here, said, hey, we've got this new person here, and how about instead of a massage, you try that? And I said, what'll it do? She goes, hey, there's all kinds of cool and different stuff. And I said, I'm game, let's do it.
Yeah, awesome.
That's how I tried it. And the second, after the first treatment, I felt a huge difference.
Yeah, cool.
In the mobility and tightness and pain in the knee.
It reduced the
it
tightness,
reduced
the pain.
all the tightness, all the pain after one treatment.
Awesome.
It's great. I have full range of motion.
Yeah.
Full range of motion.
But isn't it kind of cool? Like, we just got done with treatment. You said, like, my right knee feels better than my left. Isn't that crazy?
It's insane. We came out and I'm like, oh my gosh, after the treatment today, my right knee feels better than the left. I feel like there's nothing wrong with it right now.
Yeah.
The treatment really heightens and loosens things up and really makes you feel a lot better.
And what do you feel like after treatment? What do you feel like you gain?
I feel like I've gained a lot of range of motion. I am less stiff. I'm less tight after a therapy. During therapy, it feels great. There's times when you can tell you're really tight, and there's just things that Naprapathy, when you're here, there's things you just can't do on your own.
Right.
There's just certain muscles, certain pressure points that they can get that you can't, and that really releases tension, and you feel awesome when you walk out the door.
Yeah, you
Every
feel
time.
more energy.
More energy. Like, I have more movement, like tonight, way more movement in that right knee, and it lasts for quite a while.
That's awesome.
But just the difference is you just feel more normal with your knees than than I have in a long time.
You can live your life fuller.
Much
you can
fuller.
perform better. And the reason I bring that up too is because there might be people watching this and they might think, well, my knee doesn't move right. I'm never going to get full range of motion back. I'm never going to get an extra 20 degrees. I mean, we don't think about an extra 20 degrees of knee flexion, but I'm never going to be able to bend this much, but I'm still having pain. But maybe your story can help people realize that you can get back range of motion. It might not be perfect, but like, you're out of pain sometimes, and that's the goal.
Definitely. Definitely out of pain. I don't feel as much now. The weather's changing. We're in November.
Yeah.
And I used to feel pain instantly when there was a major weather change with rain or cold weather, and I don't feel like that anymore. A little stiffness maybe, a little bit of pain, but nothing like it used to.
And I think you touched on a cool subject, is that there's a lot of centers that have, a lot of different disciplines, but I think we got just a great team here.
And everybody here, they are on the same page. They all communicate. They all talk.
Yeah.
So that when you come in...
Oh, we talk about you.
I kind of figured that.
Yeah.
But then when you come in, everybody's on the same page.
Yeah.
They know where your areas are, and they always say, you feeling anything today? What's going on today? And you start to know your body, and they start to know you, and it's even more effective.
But like, I love working with our chiropractor, our massage therapist, And you can, it's cool. In one day, you can see a bunch of us.
Yeah, one day you can do a session that combines, the massage, the chiropractor, and the physical therapy. But definitely Naprapathy makes such a big difference because it really gets the points. When I started feeling a lot better and cut down, this is the one piece I haven't cut down a lot because it makes that big a difference to get those pressure points and the release, and it helps with the swelling. My knees have gone way down.
Yeah. Patricia, thank you so much for sharing your story, and having you in the clinic is always great. So thank you guys for watching. If you have any questions about knee pain, about what we do at Health First, or about Naprapathy, feel free to reach out. And thank you again. Yeah.
And definitely give Health First a call. The program they have here is great. It can help you enjoy life more. It can have your mobility back and the freedom to do a lot more things that you enjoy.
Cool. What she said. All right. Thank you.